Get ready for a healthcare shakeup in North Carolina. Duke Health is making a bold move to expand its reach across the state, and it's about to change the game for patients and providers alike. For years, Charlotte's healthcare market has been a two-horse race between Atrium Health and Novant Health. These giants have dominated the region's hospitals, doctors, and specialty care. But now, a new player is entering the arena, and it's causing quite a stir. In a move that's turning heads, Duke Health has acquired Lake Norman Regional in Mooresville, rebranding it as Duke Health Lake Norman. This is a significant step, as it's the first Duke-branded hospital outside the Triangle region. And that's not all. Duke has also partnered with Novant to open joint campuses across North Carolina. The details of this partnership are closely guarded, but Novant has hinted at bringing Duke's advanced specialty expertise, like cancer and gastrointestinal surgery, directly to the Charlotte market. This development has surgeons like Brian Blitzstein, who's joining the Lake Norman Hospital, excited. He believes it will create healthy competition and provide patients with more options. Atrium and Novant currently control almost all hospital care in the Charlotte region, with Atrium holding around half the market and Novant at roughly 35%. But Duke's expansion plans could shake things up. Industry observers suggest that the presence of a third provider could bring more choice and competition, offering an alternative to patients who currently travel to the Triangle for care. Barack Richmond, a health policy expert, sees this as good news for Charlotte and North Carolina. He believes it will introduce competition into a market dominated by Atrium, potentially lowering prices for patients. But not everyone is convinced that Duke's expansion is a positive move. Duke has traditionally resisted geographic expansion, focusing on its reputation as a national destination for complex care. However, their strategy is now shifting, with Duke aiming to become a regional health system and set an ambitious goal of touching 25% of North Carolina's population, almost tripling their revenue to over $20 billion. Duke's purchase of Lake Norman Hospital includes nearby medical offices and practices, and they plan to add more facilities. Blitzstein notes that Duke has already invested significantly in upgrading the hospital's technology and infrastructure to their standards, a process they call Duke-itizing. Many Charlotte area patients already travel to Durham for Duke's specialist care, especially for cancer, cardiology, and complex surgeries. The goal now is to bring that expertise closer to home, with the Mooresville Hospital acting as a central point of access for all Charlotte area patients. Duke is consistently ranked as the top hospital in North Carolina and one of the best in the country. Blitzstein hopes to bring that level of excellence to the Charlotte market, making it more convenient for patients to access follow-up care and routine imaging without having to travel long distances. But Richmond warns that by chasing market share, Duke risks diluting its academic mission. He believes Duke should be competing with the Mayo Clinic for the most complex brain surgeries, not with Atrium for knee replacements. Duke's partnership with Novant adds another layer to their Charlotte market strategy. The two hospitals plan to jointly develop new campuses, expanding access to affordable, high-quality care. They've already requested state approval to build a jointly operated hospital in Mabane, a fast-growing city between Durham and Greensboro. The partnership also includes plans for a network of outpatient centers across the state, including along Charlotte's I-77 corridor. These centers will offer primary care and specialty services like cardiology, neurosciences, and cancer care, along with laboratory and imaging services, and potentially surgery and urgent care. This move comes as North Carolina loosens its Certificate of Need regulations for ambulatory surgical centers, making it easier for hospitals to open such facilities in urban areas. Novant has hinted that Duke specialists may perform surgeries and other work in their hospitals. Matthew Hannis, a healthcare consultant, believes the partnership boosts Novant's credibility by associating it with Duke's research and academic reputation. This could help Novant compete with Atrium, which recently opened Charlotte's first medical school in partnership with Wake Forest University. Steve Lawler, a healthcare consultant and former CEO of the North Carolina Healthcare Association, suggests the deal will also make it easier for Novant to participate in advanced research and treatments, providing smoother access to Duke's specialized services and clinical trials. Joint ventures like Duke and Novant are becoming more common as hospitals seek expansion while avoiding merger-related regulatory hurdles. These partnerships allow for shared ownership, operations, and risks, as seen in the recently announced Children's Hospital in Apex, a joint project between Duke and UNC Health. Other hospitals have taken expansion further, fully integrating with other systems. Atrium, for example, has combined with Novant Health, Wake Forest Baptist, and Advocate Aurora Health to form the country's third-largest public healthcare system. In its financial filing, Duke hinted at the possibility of deeper integration with Novant, suggesting the partnership could lead to future collaborative opportunities. Hannes believes this alliance could be the first step towards a larger merger, as both systems need to build scale to compete. Many questions remain about the partnership's specifics, such as whether Duke doctors will practice in Novant hospitals or if they'll collaborate virtually. There's also the potential for new hospitals in the Charlotte region and the impact on healthcare costs and access. For patients like Marlene Tonto Donato, the partnership's impact is personal. Tonto Donato, 77, sought a third opinion at Duke after local doctors disagreed on whether she needed spine surgery for her scoliosis. She appreciates Duke's conservative approach and expertise and hopes they bring their own doctors to Charlotte rather than absorbing local physicians. I have more faith in Duke because it's a teaching hospital and they have expertise that I think we are lacking in Charlotte, she said. This article is part of a partnership between the Charlotte Ledger and North Carolina Health News, aiming to enhance healthcare coverage in the Charlotte area. Stay tuned for more updates on this developing story.